you. Thank you. Thank you.
Now we are admitting everyone, sir. So once we admit everyone, we'll start the meeting, sir.
Okay.
Very good morning, one and all. So we welcome you on behalf of Vishnu College of Pharmacy to the day 2 of national webinar on recent advances in pharmaceutical sciences. Now we request our principal, sir, Dr. K. Natarasar, to welcome the participants for day 2 of this session.
Thank you, Mr. Bapraju, Dr. Bapraju, and respected today's speaker, Sri Professor Gopal sir, and my fellow teachers and my dear students. My warm welcome to 1 week online FTP HDP program entitled Recent Trends in Pharmaceutical Innovation and Research, which is commencing from 22-24 November 2023. On behalf of students, staff, and management of Sri Vishnu College of Pharmacy, Bengaluru. The main objective of the FTP is to update you the information about the technology-driven pharmaceutical innovation and how the emerging technology helping in pharma innovation. And my sincere thanks to all speakers for acceptance of our invitation, even though in spite of their busy schedule. Okay? I wish you all the best to the faculty and students. Make use of the session, and definitely promptly say that today's speaker, Professor Gopal sir, is one of the eminent in the natural products. So definitely he helps, his contribution is very significant to the pharmacy, especially for natural products. Okay, so I request all of them, please make use of the session, but get benefit out of it. Okay, thank you. Over to Pawan sir.
Thank you, sir. With this note, I request our HOD of Pharmacology, Dr. K.S. Pawan Kumar sir, to introduce our speaker of today. Over to you, Pawan sir.
Yeah, thank you, sir. Thank you very much. It's a really great honor for me to introduce such a great scientist, academician, administrator, Professor V. Gopal sir. So it's my privilege to introduce him. So if we come to the qualification, like sir has completed his B Pharmacy as well as B Pharmacy in the year of 1990 from the Government College of Pharmacy, Bangalore. Further, sir completed Master of Pharmacy in the year of 1992 from LM College of Pharmacy, Ahmedabad, Gujarat. Later, sir completed his PhD from 1996 from Gujarat University, Ahmedabad, Gujarat. Currently, sir is holding the position of Principal, College of Pharmacy, and also sir is holding the position of Academic Registrar from the for the Institute of Mother Teresa Postgraduate and Research Institute of Health Sciences, a government of Puducherry institute. This institute is accredited by NAC with A grade and recognized by UGC. Further, further for his contribution, sir has received so many awards. So among those awards, now I am saying only few important awards only I am listing here. Sir sir is recipient of Bharat Sevak Award, Best Academic Administrator Award, Eminent Teacher Award, Eminent Speaker Award, Outstanding Education, National Best Teacher Award, and also sir got Certificate of Appreciation for promoting voluntary blood donation for the year 2016, 14, and 2013. Other than this, sir has received so many awards from government of Tamil Nadu also. So among few of those awards like Annai Teresa Award, Kalvi Sudhar Oli Award, etc. Professionally, sir has reached so many achievements. So one of the here I am enlisting the few of such achievements. Sir is ex-chairman for Education Regulation Committee for Pharmacy Council of India, and also he is the member of the Ethics Committee of the PCI. Further, sir is ex-member of ACTE New Delhi and expert committee member of the ACTE for the approval of the UG and PG courses in pharmacy. Further, sir is ex-member for the Southern Regional Committee and also is member of GPAT Steering Committee also. Sir is expert member for approval processes, inspection of AACTE, NBA, PCI, scrutiny committee member of AACTE, and also representing AACTE and PCI in UGC inspections. Sir is nominated member by the Government of India as a member of the Siddha Pharmacopoeial Committee, and also he is member of the Siddha Advisory Board also. And he is nominated by the government of Puducherry as Vice President of the Management Committee of the Indian Red Cross Society, Puducherry branch. Further, sir is chairman of IQAC and he is instrumental in obtaining NAC A grade for the Mother Teresa Post-Graduation Research Institute and Health Sciences. And sir is the chairman of Institutional Animal Ethics Committee and also member secretary of the Institutional Ethics Committee, and also is life member of various societies called as IPA, ISTE, APTI, ICS, IPGA. And also sir is a fellow of prestigious Indian Chemical Society. Then coming to the various academic activities, sir is approved guide for PhD studies of the 9 universities. And so far, sir guided 30 PhD scholars and all the students got awarded. Currently, he is guiding 7 students and he guided 39 master students. And also, sir is chairman for the Board of Studies for UG and PG for the Mother Teresa Institute. Other than this, he is member of the Board of Studies in various institutes like Satyabama Institute, SRM Institute, then JNTU Anantapur, Nursing Puducherry University, Annamalai University, Ramachandran Medical College and Research Institute. So he is member of the Board of Studies in various institutes. And he is also ex-in charge for the Ayush Drug Testing Lab. So far, sir published 192 papers and presented 84 papers and delivered 274 guest lectures in various national and international conferences, workshops, seminars. And also sir got filed 3 patents and published 3 book chapters, and he has arranged 14 national conferences so far, and also delivered more than 300 health and more science related programs in the All India Radio, FM radio, Doordarshan and cable TV. Sir, he knows various languages. He can speak Telugu, Tamil, English, Kannada, Hindi, and he is also having exposure to Gujarati also. And he has passed a translation test in German, passed so many exams related to French, Sanskrit, and all those things also. So, other than India, sir also visited various countries like Australia, Abu Dhabi, Dubai, Malaysia, and Singapore. With this brief introduction, I request you that Professor V. Gopal Garu to start his session.
Thank you, sir. Gopal sir, can you please share your screen, sir?
Is my slide visible?
No, sir. No, sir.
Not visible, huh?
No, sir.
For me, it is visible.
Take a host, Bapraj, I think you have to do. Otherwise, Pawan sir will share that, just like the previous.
Is it now visible?
No, sir.
Now?
Pawan sir, can you share, sir?
Yes, sure.
Oh.
Yeah, is it visible, sir?
Yes, sir.
Yeah.
Okay.
Can I start?
So Gopal sir, please go with your presentation, sir.
Please go to.
You can start, sir. You can start.
Start, sir.
Is it okay?
Yes, sir.
Okay, I can start.
Yes, sir. You can start, sir.
Okay. Happy morning to one and all. At the outset, I would like to thank the principal and his wonderful team for having arranged this faculty development program. Congratulations, sir. Thank you for this nice opportunity. I thank the head of the department for his nice introduction. And congratulations to the participants for your active involvement in this faculty development program. Today, for the next 1 hour, I am going to share my experience on the topic recent trends in pharmacognostical innovation and research. In Vijay TV, there is an anchor by named Gopinath, Mr. Gopinath. He wrote a book for the youth, Success Path for the Youth of India. This was the title of his book. He went to various colleges and tried to promote his book, but it was a failure. Nobody bought that book. He became very sad, and one day he came out with an innovative idea. He went to the publisher and told him, please change the title of my book. They changed the wrapper of the book and changed the title to Please Do Not Buy This Book. When he changed the title of the book as Please Do Not Buy This Book, out of curiosity, people started buying his book and his book became a big hit. This is called innovation. So, for innovation, which is the most required quality for research, especially pharmacognostical research. To develop this innovative attitude, there are a number of approaches. One important approach is called as the curiosity approach. Can I have the next slide, please? Some 23 years back, we did a small experiment in Chennai. In a very busy road, we erected a tent, and inside the tent, we kept one motion sensing camera. Outside the camera, there was a small hole, and over that hole, it was written, "Please do not peep through this hole." We on the camera, and in the next 5 minutes, more than 100 people had peeped inside the camera. The wordings outside was, "Please do not peep into the camera," but more than 100 people peeped into the camera in 5 minutes. So this shows the curiosity of mankind. If we say don't do something, then people will do. It is because of their curiosity. So this curiosity leads to innovation. Can I have the next slide, please? Here, you are able to see the photograph of a pharmacist from North Carolina in America. His name is Richardson. This person, Richardson, had 3 sons, and all the 3 sons were suffering from cold. So his wife became very angry with him. As a pharmacist, can't you do something with this? So he did research on 21 herbs. And at the end, he was capable of patenting those herbs and their formulations. At the end, he came out with a salve. This formulation had menthol, camphor, and turpentine oil. When this formulation salve was rubbed on the chest of the babies, because of the body temperature, the menthol evaporated and it gave a soothing effect. And the children were able to overcome the problems of having frequent cold and flu. So this formula was very handy, and then he started preparing it at a lab level, and he started distributing it to his friends and relatives. His close relative, his brother-in-law, was a doctor called Joshua Wicks. He was fascinated by this formula, and he started promoting it in his name. So that was called as Wicks Vapor Rub. His name was Joshua Wicks, and he promoted it in his name, Joshua Wicks Vapor Rub, which later became Wicks Vapor Rub, but it was prepared, formulated, designed by a pharmacist, Richardson. When this formula came to India, initially it had a very good growth because in India, many people were suffering from cold and flu. And in Surat, one woman discovered that when you apply this ointment in hot water, so the fumes that come out when you inhale, it has a better soothing effect, and it can be used as an inhalation therapy. So this discovery of one of the user of this product was propagated by the company. The company, named as Richardson Hindustan Limited, became very popular because of this inhalation therapy. Later, during Chinese aggression, the raw materials were not available. So they were manipulating with the raw materials and the cost increased. Then there was a strike by the Chemist and Druggist Association, which affected their sales. Their product came under drug price control order, So they were not able to make any profits. The company was not able to sustain. They sold the company to Procter and Gamble. So in Procter and Gamble, there was one Mr. Rajagopalan who tried to revive this product. He got an interesting idea. He went through the raw materials like menthol, camphor, and instead of using the raw materials, he started using the volatile oil which had the raw materials. And then he associated that volatile oil with the ingredients in Ayurveda. And slowly he declared that that Vicks was an Ayurvedic medicine. He registered it in India as an Ayurvedic formulation, and because of that, he was able to escape from drug price control order, and he got a lot of benefits, and the product became a mega hit. Here, we should remember two things. One, our regulation was weak to accept a modern medicine as an Ayurvedic product. In Ayurveda, there is no mention about this Vicks formula. So our regulation has to be made strong, and it is now strong. Now this cannot be done. Number two, the innovativeness of the people who are behind this Vicks formula, Vicks Vapor Rub. So though it is a modern medicine, they have beautifully made it align with the traditional system of medicine Ayurveda. And because of their advertisement strategy, in the minds of all Indians, they have made that Vicks is an Ayurvedic formulation. Can I have the next slide, please? Yes. So here we will have to remember two words. The first word is research. Research means you will have to search, research, again search. So if you search and search, what you will do? You will be able to discover. Nature has many things covered. So if you remove that cover, that is called discover. So here, discovering is very, very important. And for discovering and research, innovativeness is very important. Can I have the next slide, please? Here, you can see the details of Lunsford Richardson, a pharmacist who formulated Vicks Vapor Rub. Can I go to the next slide, please? So, to be innovative, the first requisite is curiosity. What is the second requisite? The second requisite is holistic thinking. Long back, when Dr. APJ Abdul Kalam came to Pondicherry, he wanted to meet the students. But because the students were very good in number, he didn't have the time to meet them. He wanted to have a personal interaction with two students. So selecting two students from a large gathering was very difficult. So for that purpose, he asked them So many people said that the log of wood will fall down, the log of wood will break, the log of wood will create some noise. But one Kendra Vidyalaya student beautifully said, if I am on the earth, if I have a log of wood, if I drop it, it will fall. If I am under the water, if I am having a log of wood, if I leave it, it will go up and float on the surface of water. If I am in the space, and if I am having a log of wood, if I drop it, because there is no gravity, it will remain where it is. So that student was selected for an interaction with Dr. APJ Abdul Kalam. So this question is a clear indication of holistic thinking. So for research, we need two things. One is curiosity and another one is holistic thinking. Next slide, please. A modern doctor who has applied both these principles, holistic thinking and curiosity approach, and has become a pharmacognosist, is none other than Samuel Hahnemann, the founder of homeopathy system of medicine. Samuel Hahnemann was informed that the Jesuit priests were successful in South America in spreading Christianity because of their knowledge of a bark called cinchona. The tribals of South America were using the cinchona bark as a cure for malaria. This information from the tribal doctors was taken by the Jesuit priest and successfully implemented among the general public. And when Samuel Hahnemann knew about the medicinal properties of the cinchona bark, he took a piece of bark from the Jesuit priest and he ate the bark. He observed that if a malarial patient is given this bark, he becomes normal. Samuel Hahnemann was a normal man. After eating this bark, he developed the symptoms of malaria. So he thought about it for a long period of time, and then he came out with the concept like cures like. When you cut onion, you have tingling sensation on your nose, you have tears on your eyes. When you have cold, you have sneezing and tears on your eyes and tingling sensation on your nose. So if you can go for an alcoholic dilute extract of onion and give it for cold, you can cure cold. So that is like cures like. And this homeopathy system of medicine, which has become an international system of medicine because it has no side effects. During COVID also, the arsenic album, their formulation, was widely used by the general public. Next slide, please. The third criteria that is required for innovation in research on medicinal plants is extrapolation. Last year, we conducted an essay writing competition for school children. The topic was, if I become an MLA. As soon as we rang the bell, all the students started writing that essay. One fellow did not write anything. As an observer, I went to him and said, you have any problem? Do you want water? Why you are not started writing? He gave a beautiful answer. So what is the topic? The topic is, if I become a MLA, member of Legislative Assembly. Okay. Then that boy said, sir, now as I have become a MLA, my PA will come and write the essay. That is why I am not writing. So this is called as extrapolation. Next slide, please. We can see a very successful story of a person who has extrapolated and come out with a great invention and discovery. On this photograph, you are able to see a person. His name is Getafosse. This Getafosse was a person who used to buy essential oils, mix them with organic solvents, and sell it as a perfume. When he was doing this, accidentally, the organic solvent spilled over him, and there was a naked flame, and his hand caught fire. Out of impulse, he dipped his burning hand into lavender oil that was available nearby. When he removed the oil, his hand, he found that there were no burn scars and his burns were completely healed. So he understood the healing power of lavender oil, and he started doing research on various volatile oils that can be used for therapeutic purpose. Next slide, please. This incident took place in 1910. And from that, he started using essential oils in surgery, and he formulated Salvol, the first aromatic antiseptic. So he is called as the father of aromatherapy. And he was able to discover this aromatherapy because of curiosity, because of his innovativeness, and because of extrapolation, and finally his holistic thinking. Next slide, please. Today, we Indians are facing a major problem. 200 years back, Indians were highly innovative. The first university in the world was in Takshashila. The second university in the world was Nalanda. India donated 0 to the world. Trigonometry, algebra are gift of India to the world. Caesarean operation, cosmetic surgery, reconstruction of nose, removal of kidney stone, operation for glaucoma, they were all done by Shushruta. So they were all able to do this because they were thinking differently. But currently, we Indians are under the trap of the media. When we watch a TV, we are absorbed to that data and we think as the media guides us. Today, our thinking process is guided by the media. Independent thinking, thinking differently is not there. In those days, when I was studying 8th standard, my language teacher used to describe about a local warrior. And when he describes him, he used to describe how his hair was, how his behavior, how his speech. So when he was describing him poetically, we used to imagine his face. But today, because of the development of technology, they have made a small video of that hero and it is projected on the screen. So the students, when they see the video, they get data, but their imagination is not kindled. When the imagination is not kindled, they cannot think differently. When they are not able to think differently, they cannot be innovative. If they are not innovative, they cannot do research. Next slide, please. Here, you are able to see the photograph of Sidney Ringer. Ringer was fascinated by animal tissue culture. In lines of plant tissue culture, he was trying to cultivate the animal tissues, but it was a failure. He thought the microorganisms are responsible for the death of the isolated animal tissues. So he was performing his experiment in a sterile environment with tripled distilled sterilized water. One day, accidentally, his attender gave tap water labeled as triple distilled sterilized water, and he performed the experiment with that, and that experiment was a success. Later he came to know that it was not triple distilled sterilized water and it was only tap water. So he analyzed the composition of the tap water and then he came out with his Ringer solution, which we use even today. So for this discovery of Sidney Ringer, he has thought differently. He has extrapolated the mistake that has been done in his lab. He had used holistic thinking, and he was curious to find out how the animal tissues are alive when done in a new experiment. So the first quality that is required for carrying out innovative research in pharmacognosy is curiosity. The second quality is holistic thinking. The third quality is extrapolation. The fourth quality is thinking differently. And the fifth quality that is required is called converting negatives to positive. Can I have the next slide, please? Can I have the next slide, please? In Kerala, there was a person by named Mr. Gopal Krishnan Nair. He was a postgraduate in chemistry, and when he was carrying out certain medicinal herbs, he observed that when the extract of that medicinal herbs fell on his wrist, there was hair growth in that area. So he did research on those medicinal plants, and then he had formulated Anoop hair oil, an Ayurvedic product without advertisement that was selling 60,000 bottles at that time. But he did not have a very good knowledge on pharmacognosy. So he was dependent on some medicinal plants which were endangered. And now the medicinal plants are not available. And so his product efficacy is on the slide. But still, he is continuing his research, and he is a founder of Arshik Herbal Remedies in Thiruvananthapuram, and he is the state president of Ayurvedic Medicine Manufacturers Association. So his power of observation, his power of converting negative to positive. Suddenly he observed that there was more hair growth on his wrist. So that was negative. Everybody was criticizing him. You are having so much hair on your wrist. So he thought if the same amount of hair can be grown on the scalp, then that would be great. So that is converting negative to positive. That is a quality that is required for carrying out innovative research on medicinal plants. And this is the example. Next slide, please. Can I have the next slide, please? The next slide. In 1903, a French chemist was working on a chemical reaction, and when that reaction was going on late night, one rat was creating a problem. So to chase away the rat, he was trying to hit the rat, and it was running here and there, and at one period of time, the entire chemical reaction containing vessel slipped and fell down on the floor, but it did not break. So if a glass falls on the floor, it should break, but this glass did not break. So he started doing research on why the glass did not break, and he became the inventor of bulletproof glass, which is protecting the VIPs today. Next slide, please. Next slide. Here on the photograph, you are able to see an organic farmer, a pharmacognosist by name Nammalvar. He was fond of growing corn, cultivating corn. And his corn was so healthy and so nutritious that every time the Indian Council of Agricultural Research competition, his corn used to get the first prize. So there was an interview in the Doordarshan asking him how every time he is able to win the prize, is he keeping the seeds of his corn as a secret in a safety vault? So he said, you're not able to understand the concept of nature. What this person Nammalwar does is, whatever seed he has, he gives it to the neighbors and asks them to grow the same corn. He doesn't keep the seeds to himself. He believes in pollination. Only if the neighboring field products are healthy, his products will be healthy. That is his belief. And today he has created a revolution in our Indian agriculture, especially organic farming. So his concept, his observation that if all the neighboring fields agricultural products are healthy, his product would also be healthy, is a very innovative step. Next slide, please. Here on the slide, you are able to see one person. He is Padma Shri Dr. Pushpangadan. He was a director of Tropical Botanical Research Institute in Trivandrum, and he was taking his students to a hilltop called Agastya Hills. The local tribals were helping him and his students in carrying their luggage. Dr. Pushpangadan and his students were very tired, but the tribals were very energetic. So he asked the tribals, how come they are so energetic even after climbing a steep hill? The tribals said that they are chewing the leaves of a plant called Trichopus xylanicus, which they call it in local language as Arogya Pacha. So this person, Pushpangadan, he took the leaves of Trichopus xylanicus from the tribals, and then he ate the leaves, and instantly he felt rejuvenated. So he came down and he did research on this plant, and he was able to isolate the phytoconstituents which had a beautiful property of adaptogenic. This plant has the potential of ginseng. So just like an Indian ginseng, it was providing all the qualities of ginseng. He had marketed it and he has generated a lot of funds. And from the funds that has been generated by marketing the phytoconstituents of this plant, Trichopus xylanicus, he gave back all that funds to the tribals. He helped them to come up in life. He changed their lifestyle. He got them insurance. He got them education. And for that, the government of India has recognized him with Padma Shri Pushpangadan, Padma Shri Award, and he is called as Padma Shri Palpu Pushpangadan. So this real incident, this inspiration is a success story on research on medicinal plant, Trichopus xylanicus. So this success was because of all the characters that I mentioned before. Number one, power of observation. Number two, converting negative to positive. Number three, thinking differently. Number four, extrapolation. Number five, holistic thinking. And number six, curiosity. So with these six qualities, Dr. Pushpangadan was successful in helping the tribals and also in helping the general public with a beautiful formula from this plant Trichopus xylanicus. Next slide, please. Whenever you hear the Africa, two things will come to your mind. One is giraffe and another one is acacia tree. So initially, acacia tree had a leaf all over. But when the grazing animals started eating the leaves, they started having leaves only on the top. And you can see on the bottom there are no leaves. To protect themselves from grazing animals, the acacia tree started modifying itself. They started developing thorns. The thorns were larger, the leaves were shorter. So no grazing animal was able to eat the leaves of acacia. But this giraffe, it started modifying itself. It started developing a long tongue and a very thick lips. So thick that the thorns could not pierce the lips and the tongue could go in between the thorns and take the leaf. After this, the acacia tree started modifying itself. It started producing tannins and some phenolic compounds such that the leaf became very bitter. So other grazing animals were not eating it. But giraffe, they started eating this bitter leaf and slowly lost their bitter taste buds. Then the acacia leaf started developing phytoconstituents that interfered with the digestion of the leaf. So many animals were not eating this leaf, but the digestive system of giraffe started developing enzymes that can digest these leaves. So like this, the fight between the acacia tree and giraffe is going on in nature. So this observation itself is a beautiful research in the subject of pharmacognosy. Next slide, please. Next slide. When we are trying to do innovative research on medicinal plants, we should be very cautious. Sometimes this innovativeness leads to pseudo research. In Ayurveda, there is one product called Chavanprash. So it has 46 ingredients. Sorry. And the major ingredient is amla. This product is popular because of its vitamin C content. The lipid level of this formulation plays a major role in preserving the vitamin C and preventing its denaturation. So some people wanted to be innovative and they have come out with a biscuit of this Chavanprash. So when they tried to formulate it into a biscuit, the lipid content got reduced and the vitamin C was denatured. And when they prepared the biscuit did not have the therapeutic efficacy as that of the Lehia, the Ayurvedic formulation. So when we are trying to do research, we should be very cautious that it doesn't backfire like this case of Chavanprash biscuits. Next slide, please. Some 40 years back, people were brushing their teeth with the help of meshwak, neem twig, banyan twig, and the like. 80 years back, people were brushing their teeth with salt. 160 years back, people were brushing their teeth with charcoal. Later, there was a movement that said, no, you have to use paste and brush. Initially, the brush was flat. Then the brush became zigzag. Then the brush became crisscross. Now the brush and the chewed twig both look alike. And now in our advertisement, our advertisers are asking, does your paste have salt? Does your paste have charcoal? Initially, our paste was only charcoal and salt. Because of pseudo modernization, pseudo research, we have lost them and we have become addicted to chemical. Next slide, please. In Tamil Nadu, on hilltops, you can find this plant called Corallocorpus epigeus. So this plant is said to ward off evil spirit. So it was tied on the entrance of every house. It was cultivated widely in every house. The reason behind this wide popularity of this plant is not that it can ward away evil spirit, is that it is an antidote for snake bite. So initially it was used as a first aid for snake bite, and slowly it was retermed as it can ward off evil spirit. And now this misconception that this plant can ward off evil spirit has become very popular than the use of this plant as a first aid for snake bite. The next slide, please. 100 years back in Tamil Nadu, people were using the rice that was cooked yesterday. The reason, the yesterday cooked rice was soaked in water and there was growth of yeast. So yeast made that food rice assimilable. But today in the rice, we are having pesticide residue, and therefore there is no yeast in rice. And this concept of keeping rice in water for overnight and then consuming it is lost. And in the process, the knowledge of the medicinal plants is also lost. Next slide, please. Next slide, please. Next slide. 2000 years back in India, the medicine was tailor-made. The medicine was given for free. Because the medicine was given for free, there was no adulteration, there was no substitution. Today, everything is for profit. When profit takes the driver's seat, ethics takes the back seat. So the tailor-made medicine, the free medicine of yesteryears is not practiced today. And the lack of innovativeness has made the practice not so successful. Next slide, please. Because of paucity of time, we can skip the next 5 slides. Yeah, we can stop here. So I will end with this slide. Yesteryears, Indians were using turmeric. Turmeric was used in auspicious functions, in a birth house, in a death house, in a puberty function, in temples. But today, science has proved that turmeric has a compound called curcumin, and this curcumin is antibacterial, antiviral, antifungal. But yesteryears, the use of turmeric as an antiseptic was the maximum. But today, the use of this turmeric as an antiseptic is the minimum. Next slide, please. Next slide. See, here in this slide, you can see that this one compound, curcumin, is scientifically proven to be beneficial in so many conditions. In viral disease, in inflammatory disease, in metabolic disease, in skin disease, in cardiovascular disease, in neurodegenerative disease, in cancer. So in all these conditions, this turmeric, the phytoconstituent curcumin, is very much beneficial. But today, because of greed, this turmeric is being adulterated. Next slide, please. You can go to the market, you can buy a small piece of turmeric, and when you put it in water, the water becomes colored. That is, it has a dye, and the dye is nothing but lead chromate, which is harmful. Next slide, please. So the artificial color in turmeric, the dye used in turmeric, has killed the therapeutic benefits of turmeric. So I would like to conclude that the research that is being carried out on medicinal plants should be for the betterment of mankind, should be for preserving the nature, and should have a curiosity component, should have a holistic thinking component, should have an extrapolation component, should make the researchers think differently, should make the researchers convert negative to positive, and should give the researchers a power of observation. And these qualities of Indians yesteryear has to be preserved today also, so that in innovative quotient and innovative index, India can come up and serve the world. So with this, I thank all the active participants for your patient listening and active involvement. I thank the organizers for this wonderful opportunity, and I am now open for questions. Any questions, please ask.
Any questions from the audience? Please unmute and please ask any questions. For the participants on the YouTube, maybe you can put your questions in the chat box. We'll collect that and we'll take that to Gopal sir. Any questions from anyone?
Yeah, sir. Meanwhile, just I have one question, sir.
Yeah, please.
Yeah, sir, yes, as you said, this is the power of Ayurveda. And hello, sir.
Sir, you are not audible, sir.
Hello.
Now audible, sir.
Yeah, so how to fix this one? How to check the toxicity profile of this plant, sir? Even though plants are having many beneficial roles, but adjustment of the dose, especially related to few plants that are suffering with the toxicity profile. Even though they're
Yes,
having good therapeutic activities, but because of their toxicity, it is limited. So that's why we are going for the semi-synthetic derivatives also. So what is the criteria, sir, for testing the toxicity profile of the drug?
Yes, sir. So thank you very much for your beautiful question. The World Health Organization has come out with guidelines for testing the toxicity of medicinal plants. I was mentioning about this turmeric. In this turmeric, this toxicity is man-made. So the government of India has come out with a guideline called DART, D-A-R-T. detect adulterants with rapid test. If you take this turmeric and if you just sprinkle it in water, if it is a pure turmeric, the water will not have any color. If the turmeric is adulterated with lead chromate or any other dye, the dye will give a color to the water. So just by putting turmeric in water, you can find out whether it has been coated with a dye or with lead chromate. So this is a rapid test. So like this, we will have to come out with rapid tests, and there are guidelines for it. Basically, our Indian system of medicine is based on the phenomenon that food is medicine and let medicine be your food. So all edible items, edible plants, they were all consumed as medicine. But today, in the name of accelerated cultivation, unscrupulous use of pesticides has left the pesticide residue in the plants, which have become carcinogenic. And for that, the alternative is organic farming. There was a recent study in a bunch of grapes purchased from the market. On the outer skin, there was so much of pesticide that when washed with water, they didn't go. When washed with the turmeric water, it didn't come down. When washed with oil and turmeric water, and when using heat in running water, it was removed. So like this, we will have to approach in two angles. One is detection of toxicity, and another one is changing the way of thinking, innovative research on organic cultivation. So when organic cultivation is done, all this man-made adulterant substitutes can be easily overcome. So it is an attitude to save our systems of medicine. And finally, when profit takes the driver's seat, ethics takes the back seat. In yesteryears, the medicine was for free. So when it is given for free, there is no need to adulterate, there is no need to substitute, so there was no toxicity. Now everything is money. So everyone wants high profits. So when profit takes the driver's seat, ethics takes the back seat, and that is why we are suffering. And we can overcome this by attitude management and by organic farming and by carrying out research on detecting adulterants as per the guidelines of World Health Organization. Thank you, sir. Thank you for your interest.
Yeah, thank you, sir. Very nice information. Yes, like obviously, like ethics should be at front seat. Yeah, sir. Like one more question from our participant, sir. Like maybe he's doing his PhD, so what he's asking is like how to select the plant products for his research. He's interested on the like prevention of miscarriage in pregnant women, sir. So he's doing work on preventing miscarriage in pregnant women. So that is his interested area. So how to proceed with his research?
All the best to the scholar, my dear scholar, for preventing miscarriage. Both in Ayurveda and in Siddha, there are a number of formulations. These formulations are available in the official textbooks of Ayurveda and Siddha. Because they are official as per Drugs and Cosmetics Act, the phase 1 study need not be carried out. Now, the problem with these formulations is that these formulations have not been standardized. Raw material standardization, in-process quality control, finished product quality control studies have not been carried out on these formulations. So if this scholar at his capacity can carry out the raw material standardization of those Ayurvedic and Siddha formulations useful in preventing miscarriage, then it will be a boon for mankind. And this service of this scholar will be acknowledged by the entire human race. So that is the need of the hour. our forefathers have devised beautiful formulations, and all these formulations have now become defunct because they are not standardized. So standardizing the raw materials and the in process and finished product of these formulations is what we can do to our glorious tradition. And that is the shortcut for successful formulations. The candidate to do a literature survey on Ayurvedic or Siddha formulations useful in preventing miscarriage. And based on the review of literature, let him select one popular formulation. Let him standardize the raw materials. Let him do in-process quality control studies. And at the end, let him standardize the final product. And this work will be a real boon and will give him a lot of happiness and contentment. Thank you.
Yes, sir. Thank you, sir. Like, it will be helpful for his research. So, like, mainly, like, we need to search the Ayurvedic formulations as well as the Siddha formulations present in the textbooks. Yeah, sir. One more question. Like, one of the scientists, Dr. Kiran, he is asking that, as curcumin, so many natural compounds, they're having a very good therapeutic potential, but they're having good therapeutic potential. But however, very few drugs are in the market as a formulated products. Any reason for it, sir? Like even in case of the curcumin also, like no such formulations are available. Like in case of the tablets or capsules or syrups, that kind of. Is there any possibility to develop the formulations for the natural products, sir?
It is a beautiful question. At the outset, I congratulate the person who have asked this question for his involvement on his holistic thinking. Years, our forefathers were concentrating on taking the drug as a whole. Like for example, when you take apple as a whole, the nutritional value is more. If you remove the skin of apple and then if you take that apple, the nutrition value of apple comes down by 30%. Similarly, if you take a herbal, if you take the drug as such, then it will be having a wonderful activity. If you try to isolate the secondary metabolites, the activity will come down by 15%. If you try to isolate a particular secondary metabolite like alkaloid, glycoside, tannin, phenol, that particular active constituent may have activity, may not have activity. So usually in plants, all this compound, they work on synergism. So in yesteryears, the catchword was take medicine as a whole, eat food as a whole. If you eat a fruit as such, you will get fiber, you will get minerals, you will get lot of nutrients. You remove the outer skin, you make a juice, and then you filter it, and then you take the add preservatives to the juice, you pack it, and then you take the packed juice. It will have nothing. So that is why our forefathers were formulating in such a way that the medicinal plants therapeutic activity is not lost. On turmeric in Ayurveda, there are more than 100 formulations. In Siddha, there are more than 150 formulations. So these formulations have been documented and they have entered into their respective pharmacopoeia. A few of them, like for example, 6%, have been standardized at a very preliminary level. Rarely one or two formulations have been completely standardized. So at this juncture, going for formulation is not advisable. Formulation of all efficacious herbs are already available. Only thing is, we will have to modernize that formulation at par with modern medicine in such a way that the originality of that formulation is not lost. I gave you an example of Chavanprash. Chavanprash is a legume. So Asava, Arishta, Legium, Churnam, these and all are Ayurvedic formulations. So legium means the consistency, the lipid content, that is important. So in the name of modernization, if you make it into a biscuit where there is low lipid content, the vitamin C in the process gets denatured and is lost. So our forefathers have already done this exercise. Our work is only to take up that exercise further. So as far as possible, what now is the need of the hour is not formulation, but standardization. Thank you. Thank you for your interest.
Yeah, thank you, sir. So one more question, like from the participants, they're asking that curcumin can be used as an antiviral.
Yes. It's a very beautiful question that he has asked. Curcumin can be used as an antiviral. I have a slide on that. I just showed it. You can see that acquired immunodeficiency syndrome. So even for AIDS, scientifically, it has been proved that it is beneficial. Okay, so this curcumin, the antibacterial, antiviral, antifungal, antimicrobial activity of curcumin has been scientifically studied and it has been proved. If you go through the literature, you can get a lot of information on curcumin. But what is more important is the stability of curcumin. So our forefathers, they were able to find out that this curcumin along with lime, we call it as chunna. So when curcumin along with lime, it becomes red in color, and this simple formulation is able to keep the curcumin effective, and this is called as kumkum. So here on my forehead you can see something red. So that they have given a religious label to this formulation. So kumkum is nothing but a formulation where the curcumin is kept effective so that it can perform its duty as an anti-cancer, antiviral, useful in cardiovascular disease, neurodegenerative disease, skin disease, metabolic disease, and inflammatory disease. So this curcumin, the efficacy of curcumin is improved when it is kept along with lime, chunna. So this has to be appreciated. This has to be scientifically studied and patented. So Marshall Kerr, the CSIR director, beautifully said, publish and perish, patent and cherish. Now, if we start publishing, our counterparts in other foreign countries, they have so much of facilities, they can carry out this research, which we do for a year, in a month, and they will get a patent for it. So this is an era of patenting. So whatever research you do, please have this concept of patenting it for the benefit of our country. Or please log on that information in traditional knowledge digital library so that this information will be available in public domain and it cannot be patented by others. Thank you very much. Thank you for your interest.
Yeah. So one more question is there, sir. Can I ask, sir? Or time?
Yeah. Please. Unless and until the participants are hungry, I have no problem. I am not hungry.
Sir, like one person, he's asking that, as you said, like curcumin, it is having huge therapeutic activities, but the yield, is it same from all the varieties of the turmeric plants, sir, or use it to vary?
Yeah,
the yield,
it's a very
yield of the curcumin. And also with this connection, he's asking one more thing, sir, like is there any specific methods or specific time is there to increase the yield of the curcumin from the turmeric?
Yeah, very good, beautiful. So he has applied all the concepts that we discussed today. Congratulations to him. So today, the cultivation of medicinal plants, it's dependent on various characters. So if we use a particular fertilizer, that fertilizer may advocate a particular pathway, and that pathway may not lead to the production of curcumin. See, plants produce carbohydrates for their consumption, fat for their consumption, protein for their growth. They produce waste products. They are called as secondary metabolites. They produce products for their protection. They are called as secondary metabolites. So curcumin is a secondary metabolite. Curcumin is a product from the plant that has to be produced on a particular pathway. So this pathway has been explored, and the precursors for improving the product through this pathway have been identified. When these precursors are added, the percentage yield is more. That is
Sir, your mic is muted, sir.
at the time of collection. So research are going on in these areas to identify which variety of curcuma langa gives the maximum amount of curcumin. And they have found that this is a what you call curcumin level is more in those roots that are growing on northern direction. So the processing of the collected corms, so that also has a role in preserving the percentage of curcumin in the raw material. So like this, a lot of research has been done. A bit of literature review will give him ample information on the methods used in the cultivation of turmeric to improve its curcumin content. Thank you. Thank you for your interest.
Yeah, thank you, sir. Thank you so much, sir, for your good elaboration. Yeah. From my side, these are the questions, sir. Yeah, I request participants, if you have any questions, please raise. Just you can take last 1 minute. So within 1 minute, if you pose any questions, we will ask and you get the clarifications.
Explanation was very clear. No questions from any of the participants. At this note, I propose my vote of thanks to Gopal sir, spending his valuable time with all of us and motivating all of us in a pharmacognostic way. And really, your presentation is so extraordinary, sir, that a lot of inspiration and the quotes that you give during the talk was really extraordinary. It always motivates young teachers like us. So once again, on behalf of Sri Vishnu College of Pharmacy, we thank you, sir, for all the time you have spent with us. Really, it was a fruitful day we had. And also, I thank all the participants for your presence here today. Hopefully, your active participation motivates the organizers all the time. Thanks for all your fantastic questions for the day. And hopefully, we'll have a day 3 in the same way. So thank you all.
Tomorrow 2 p.m.
Yes, sir. So small announcement regarding tomorrow's day 3 session. So which is actually planned on 11 o'clock, but it was postponed to 2 p.m. tomorrow. Thank you all and.
Thank you, Gopal sir. Excellent. No words.
Thank you, sir. Thank you, sir. Thank you. Thank you very much, sir.
And we learn many things after attending this session. Okay. So definitely, I will be in touch with you, sir. Thanks for your kind cooperation with us since last
Thank
year.
you, sir.
You are
Thank you, sir.
associated with us. Okay. Thank you, sir.
Thank you, sir. Thank you. Thank you. Have a wonderful day. Thank you. Thank you for yourself and your entire team, sir. Thank you, sir. Thank you.
Thank you.
Yeah, thank you, sir. Thank you, Gopal, sir.
Thank you very much, sir. Thank you for the nice introduction. Thank you for the nice help. The last minute, the slide did not, I was not able to share it. So thank you that you have shared it. And there was one message that was constantly blocking the screen. That was so many people are there in the waiting room, admit this, that was totally blocking the screen. I don't know whether it was only for me or for others, but it was okay. That was the only thing. That was okay. Thank you very much, sir. Thank you for your help.
Thank you.
Thank you, sir.